welcome to today's session. We'll be covering NDIS change of situation, managing a change in a participant situation today. This webinar is hosted by Endeavour Foundation in partnership with Support Coordination Academy. And your presenters today are Mary Ingerton. Mary is the Managing Director of Support Coordination Academy. And our other presenter today is Nikala Chenoweth, Head of Business Excellence Home and Community at Endeavour Foundation. Just so you know, today's session is being recorded, and the recording will be available to everyone who registered after today's session. And we'll allow some time at the end for a Q&A session with Mary, and then we'll finish with the drawing of the lucky door prize winner. I'll just take you through a quick welcome to country. So Endeavour Foundation acknowledges the traditional custodians of Australia and their continuing connection to land, sea and community. We pay our respects to past, present and emerging and extend that respect to all Aboriginal and Torres Strait Islander peoples today. And moving on. So before I hand over to Mary, I'd like to introduce you to our first presenter, Nikala Chenoweth. Nikala is the Head of Business Excellence Home and Community at Endeavour Foundation.
Wonderful. Thank you, Gemma. And it's wonderful to see so many people joining us today for what is our third webinar for support coordinators. As Gemma said, my name is Nikala Chenoweth, and I'd like to take the opportunity to talk to everyone today a little bit more about Endeavour Foundation and how we support our clients through changing situations. So Endeavour Foundation has been supporting people with disabilities for more than 70 years in communities right across Queensland and into New South Wales and Victoria. We support people to live, learn and thrive, and we do this with services such as supported independent living, community participation, in-home supports, community group programs, supported employment and much more. One of the things I'm really passionate about at Endeavour is continuous improvement, and I wanted to speak to you quickly today about two current continuous improvement initiatives. So hopefully a lot of you on the line would already have heard about the My Home, My Life project. This is a major commitment by Endeavour Foundation to invest in building new accessible housing and also to renovate existing housing to the highest standards. So if you're interested in learning more, please jump onto our website. It's a really exciting program. The second initiative is a more recent initiative which we have launched to review the supports of every single person who's living in our supported independent living homes and make sure that this aligns with their NDIS goals and funding. So we have a team of specialist disability practitioners who are spending in excess of 15 hours per client, deep diving into all of the client reports, allied health reports, and talking to our frontline to make sure that our services are aligned with client needs and achieving greater outcomes. And through this process, we have uncovered at times clients who've had change of situations. So we've been engaging with support coordinators like yourself to start conversations around changing situations. And I wanted to share with you today two takeaways that we have made over these last 4 months. The first is the absolute importance of the relationship between the support coordinator and the service provider. As a service provider at Endeavour, we have the absolute privilege of supporting clients on a regular basis, often daily. And what this means is we are well positioned to observe and notice changes within their life and to evidence that for you. Support coordinators also have a really vital role in that you've got a holistic view of people's needs, and also that collaboration across a number of different stakeholders. And so as we've been fine-tuning our process, one of the key things we're making sure we're doing is reaching out to you as support coordinators as soon as we see any changing situation, and then working together to engage with further stakeholders. The second big learning for us has been the importance of making sure that allied health reports reflect client support needs. Now, I know everyone on this line would probably appreciate the weight that the NDIA place on these reports. And as providers, we also really rely on these reports to help us to look at how we continue to make sure that our supports align with people's needs. So as soon as a report comes through, we need to be reading that as the service provider in detail and making sure that it does accurately capture people's support needs. And if at times we do notice that there's something missing or askew, reaching out to those authors and sharing the evidence that we have at hand. So they're two really important things that we have been embedding in our processes as we've gone through this continuous improvement initiative. What I want to finish up with sharing with you today is a recent example of where we collaborated really positively with an extremely proactive support coordinator through a change of situation to achieve a really good outcome. And I'm going to call the client that we achieve this outcome for Mac for all purposes of today. So Mac has lived with Endeavour Foundation for many, many years, but more recently we started to absorb some changes in behaviour and some significant behaviours of concern. So our team reached out immediately to Max's support coordinator to start conversations around what that looked like. Now, Max, unfortunately, doesn't have any informal supports within his network, and so there was a very large stakeholder group that support coordinator needed to bring together to be able to support Max through this process. Unfortunately, in our first round of work, we actually weren't successful in getting funding increased for Max. But I share this because it's a perfect example of how support coordinators and providers can collaborate. So what we were able to do is we have strong partnerships with the NDIA, and we were able to escalate this one to the NDIA provider partner. In addition, the support coordinator reached out to 7 other providers locally and gathered evidence that those providers were also not able to support Max within the funding that was available. And so we were able to take this evidence back to the NDIA, and I'm very pleased to share with you that we were successful in getting a significant increase in funding for Max. Now, what that's meant is that Max has been able to move into a new home with more intense support, but also he's got funding to engage with a range of health professionals over the next 6 months to continue to support him to build the skills to have safe and healthy relationships with co-tenants so that we can continue working on Max's goal of living in a shared home arrangement. So look, I have many examples that I could share with this group today around how we as a provider work with support coordinators, but I share this one because I think it really demonstrates what can be achieved when we work together and collaboratively through this process. So I'm going to hand over to Mary now because I am very excited to be joining this session with you and learning a bit more about this process. Mary from Support Academy Coaching.
Okay. Hi everyone, hope you can hear me and hopefully you can see the PowerPoint. Everyone on the left-hand side, see the PowerPoint. Also, just to note, if you have any questions at all, we will definitely try and make time at the end for questions. So at the Q&A at the top of your screen, that's where you enter your questions. So just put all your questions in there and we'll come back to them at the end. So you can have questions for Endeavour, for Nikala or for myself. So that's just not a problem. Okay, I'm going to get started. So I'll probably talk for about the next half an hour. And then we'll hopefully have time for questions and things like that. Okay, right. So today, obviously my name's Mary from Support Coordination Academy, and all of our training is designed around best practice principles. So for this learning session today, we're going to be looking at what a change in situation means and the best practice processes involved in managing a change in a participant situation. And just to clarify, throughout the session, I'll talk about referring to a participant. So this is a general term. So when I say this, just remember that I'm always referring to anyone who might be acting on behalf or supporting that participant. So it could be a nominee, could be a parent, extended network, or family. So just to make that clear. Okay, let's get started. Okay, so what does a change in a participant situation mean? So as a support coordinator working with a participant, the NDIS has an expectation that a support coordinator will prepare a participant for unexpected events. And that's about planning ahead with a participant to support them to have that resilience around when those events occurs. So the NDIS also expects a support coordinator to have the skills to plan, prevent, and develop mitigation strategies and take steps to manage a crisis to reduce the likelihood of a risk occurring and also the impact for a participant if that risk does occur. So what does this actually mean? So when we refer to a crisis and what the NDIS are talking about, this means that when something happens in a participant's life that impacts on their ability to access those supports and services. So it also means in a crisis situation, it also often that has a detrimental effect on the participant and it could also place them at risk of harm. So there's quite a variance in what a crisis could look like because it would be different for every person that you work for. So I'll give you a bit of an example. So say you were working with a participant and an incident occurred where the participant was hurt during some transfers. So transfers from, say, from the shower to their wheelchair. And so the provider contacts you and says, look, this incident has occurred. The person, we actually dropped the person and it was around the frailty of, the impact of their disability. They had one-to-one supports and now they're going to be asking for two-to-one supports. So it's kind of highlighting that there's a detrimental impact for this person and that it's something that needs to be investigated quite quickly. So as a support coordinator, you would work with the provider to gather evidence around the increased needs. So what does that look like? What does support happen? What happened? What was the impact for the person? And starting to gather that evidence and work quite collaboratively, just like Nikala was saying before, with that provider about, okay, so this has happened. This is the impact. Let's have a look at what supports are required going forward and what evidence is required to support that request. So that's just kind of giving you a bit of an example. But when we talk about events in a participant's life, they could refer to things like life transition stages. So when a person leaves school, or they might want to move out of home, or they might be coming in and out of hospital. They could even be other events like that a person has elderly carers and that there needs to be some planning around future supports for this person. So it's about, the NDIS are talking about crises do happen, but it's about building that support network so that the person has a resilient network that surrounds them so that when events do happen, the impact isn't so severe and the person has more resilience to manage those situations. Hopefully I'm making sense. Okay. Right. So as we were just mentioning before, a support coordinator, the best way you can do to support a participant to plan ahead, but also to be able to have that resilience when these crisis situations happen, is to build that supportive network around the person. So, and also working collaboratively with those providers. So having those conversations, making sure the providers are doing those assessments on a regular basis and reviewing the participant's needs, picking up on those changes in a participant's situation and being willing to come to you and have those conversations around these things have happened and I'm a bit concerned about this. What do you think we could do? Let's work together around this. So it's about, I suppose the message I'm trying to get across is as a support coordinator, it's not your responsibility to fix everything. It's about building that collaborative network of supports around a participant and working as a team with the participant and their support network to resolve and work through challenges, work through those problems, work through some of the issues or challenges and together bring in all that expertise and personal preferences together from the participant and actually coming up with a solution that way. Okay. Right, going to keep going. So building a collaborative relationship. So when a support coordinator first works with a participant, they start to build that relationship, that rapport, and gain a more in-depth understanding of how a participant chooses to live their life. So this would include things like the people in the person's life, their support network, the services that they receive, where they live or where they want to live, and the decisions that they make on a daily basis. In effect, how they choose to have choice and control over their lives. So through this understanding, a support coordinator is able to recognise when something isn't going as well as it should. So it might be that a provider is contacting you and saying, hey, this has happened, let's have a conversation about it. Or it might be your regular interactions with a participant or their support network. And it might be really picking up on conversations or picking up on changes in behaviour or changes in decision making. It's about being aware of situations and understanding that person's situation and picking up on and addressing these things as they come up. Okay. So when I'm talking about changes in situations, I'll give you some examples. So these could include things like, say, disengagement from formal services. So a participant might start to consistently miss appointments or refuse to go to appointments. They might say or make excuses about why those services aren't working. And it might be a consistent pattern of behaviour, or it could be something one-off. So these could be due to underlying issues like dissatisfaction with the support or the service, or it could be underlying personal issues, or it could be just a change in a person's capacity. Other examples might be an unstable living arrangement. So the person might be having constant disputes with their neighbours or the landlord, or they might be constantly in arrears in their rents. So these are all situations where you would start to go, okay, so if nothing changes, this could lead to a crisis situation. So how do we address this situation now based on the information that we have at hand? So some other examples could be frequent interactions with mainstream services. So there could be frequent interactions with police or healthcare or justice. And these are often indicators that a participant is facing challenges in their life and their current support structure is often not working, or the level of support that is being provided is not working very well. There could also be risk factors in maybe the informal supports or that informal networks or relationships. So there could be, like I said before, an over-reliance on ageing carers, and the ageing carer's capacity to support that person is deteriorating. There could be exposure to social or issues within the home, like domestic violence or drug and alcohol abuse. So these are indicators that the environment that the participant is living in might be contributing to a potential crisis happening. So that's just to give you some examples. So as support coordinators, you will already start to be thinking about some of the people that you're working with, and you will already know that when you hear a bit of that information, it's about acting on it. So you got this bit of information, yes, it's kind of a pattern of behaviour or some things are happening. How do we act on that? How do we take action? Okay. So managing risk, this is coming from a person-centred approach. Support coordination is all about person-centred. It's about putting that person at the centre of any decision-making that happens. Okay. Right. So I haven't seen any questions yet. So remember to go into the Q&A, not the chat, the Q&A, and start putting your questions in there. Okay. So managing risk for a support coordinator, it's a real fine balance between ensuring the safety and well-being of the person that you're working with and their support network, but also respecting the person's, autonomy and their right to have choice and control over their supports and services. And this is a dilemma that I talk with support coordinators all the time, especially through coaching and also through our support coordination training. It's a real balance, and it's about how do you have that balance. So how to have that balance, there's a number of ways that you can manage it, and here's some strategies. So again, coming back to working collaboratively with the participant and their support network to address concerns when they arise. So being willing to step into that space and have those difficult conversations. So tell me a bit more about that. What does that mean? How does that impact on you? How do you feel about that? So then what happened? It's really that inquisitive and ability and willingness to actually step into that space and have those conversations. So this is done by using a person-centered approach to gain an understanding of the underlying issues. So what's causing this behavior, or what's causing these events, and understanding how these challenges create barriers to accessing those supports or might be creating risk for that person. The next step is to work with the participant and their support network to identify those appropriate strategies to overcome the barriers and reduce the likelihood of the risk occurring for that participant. And this is the most important part, taking into consideration the participant's individual needs and preferences. So that's where that person-centered approach comes in. It's always coming back to that participant. Yeah. So this is to ensure that the participant has true choice and control and remains central to all the planning and agreed intervention strategies. So the participant needs to agree. You can't tell a person what they need to do. We have concerns and we have opinions and we have assumptions about what's going on, but we need to dive deeper and be willing to be open to collaborating with that network and gathering that information and having those conversations. Sometimes those conversations are quite difficult, and that's okay, but that's how you build trust and rapport. That's how you build that collaborative working relationship. Okay, how are we going? Good? I'm going to keep going. Keep in mind of the time. Okay, so let's have a think about the NDIS change of situation form. So what I've been talking to you about so far is the practice that sits behind the NDIS processes, because last week we talked about the NDIS review, which happens at a number of stages around a participant's plan. We also talked about it. We're talking about now an NDIS change of situation. So the thing to remember is they are NDIS processes that a support coordinator feeds in. It is not a support coordinator's role to just think about, okay, so this is the process. How do I do this process? What sits behind that is your professional practice. So what are the processes and procedures and practice that you need to be putting in place so that you can prepare yourself to be able to feed into these processes? Hopefully that's making sense. Okay. Let's have a look at NDIS change of situation form. Right. So when should a support coordinator notify the NDIS of a change in a participant's situation when a crisis occurs? So there's a number of reasons around a change of situation form, and I'm just going to put it out there. I find the form incredibly frustrating, and I'm hoping with the NDIS review that the whole process and the communication between support coordinators or navigators, as they will be in the future, and the NDIS will be a lot more streamlined, and there'll be a lot more prioritising about how these processes are actually happened. So I'm really going to talk to you from a crisis situation. Okay, so often when there's a change in a participant's situation, a support coordinator is able to manage the event by gathering information to assess the impact on the participant and their access to those supports or services. So what happened? How did that happen? Who was involved? Who was the service provider? What was their perspective? What's the participant or their family's perspective of what happened? What impact did it have? So, and then reviewing the participant's support needs and linking in additional supports and services. So those additional support services could be linking into mainstream services that they don't already have access to, or you might be aware of some community supports like Carers Queensland or Carers Australia, whatever that might be. So it really is going back and thinking, what are those underlying issues and what are the supports that this person needs to build that resilience around their support network? As a support coordinator, it's also our role to review a participant's NDIS plan and utilise the funds that are on their plan to support the participant to use them flexibly to access additional or different supports. So at the moment, participants have a lot of flexibility in the core budget. Hopefully in the future, especially with recommendations around the NDIS review, that flexibility will be a lot more flexible. So there'll be a lot more how I see it, a lot more ability for a support coordinator or a navigator to work with a participant to create more flexibility and that resilience for a participant. So this is again coming back to coordinating with the participant and their support network to implement the additional or different support. So what do they need to look like? Is it level 1? Is it a support worker? Do they need now intensive level of support? The other thing is about thinking about how much funding is remaining, how flexibly can we use that funding, and does that once we put these flexible supports or additional supports in place, as long as those supports continue to meet that person's needs and support them to achieve their goals, then it's okay to continue to manage that situation without notifying the NDIA, because that's part of your role. It's what the NDIS is talking about in managing that crisis situation. Your role is to ensure that everyone is aware of their responsibilities in managing the situation and are working together towards the same goal. So when I talk about that, you're thinking about risk, but you're also thinking about those barriers. So do we need to link in additional speech therapy to improve the communication of the participant? Or do we need to link in more psychology support? Or is it about more support coordination now? Or is it about linking in some mainstream services? So who are the stakeholder group and how can you bring them together to collaborate and work together so that everyone's working towards the same goal? So in that situation, if there's still enough funding left, you're able to use the funds flexibly, you're able to link in those additional supports, it's able to stabilise the situation and the plan and the person has been able to still achieve their goals, then you're able to manage that crisis situation. So people on here who are experienced support coordinators will understand what I'm talking about, and you'll be able to see the difference between a change in situation and a significant change in a participant situation. So that's what I'm going to talk about next. So when I talk about not notifying the NDIA, you can still notify the NDIA, but sometimes you're not even asking them for something, you're really just updating them. But also it's about updating your case notes, updating your action plans, so that when you do your reporting, you're able to feed in that evidence to your NDIS reporting during a review to say, well, this situation happened and this is how we managed it. It's evidencing how you're supporting a participant, why a support coordination service is required. Okay, I'll keep going. Right, so the difference between a change in situation is what I've just talked to you about. Is really, to me, a change in situation is often a situation that you can manage as a support coordinator by bringing all those factors into play. The difference for me is like a significant change in a participant situation. So this is often where there's a higher level of complexity. So there might be some really ongoing patterns of behaviour that continually are placing the person at risk. So you've tried these strategies, you put these strategies in place, but then things just keep falling apart. So there's a real pattern that even though you've put additional support coordination hours in, even though you've put these strategies in place, things just keep breaking down. To me, that is crossing into a significant change in situation. So they often involve a significant change in a participant's situation where there's a higher level of complexity, a greater sense of urgency to manage the situation due to evident or ongoing risk. Also, when the funding on the participant's plan has been utilised flexibly, however, it will run out before the end of the plan, or that the funding on the plan no longer meets the person's needs. This situation has changed so dramatically, or so for example, a participant might be living at home and all of a sudden the person needs to go and live somewhere else quite quickly. So it's about the situation has changed quite dramatically, quite significantly, and the support needs have changed, their goals have changed. The funding no longer meets their needs. So, okay. So that to me is a significant change of situation. So a significant change in situation to me, again, I keep coming back to the change in situation form. It's quite confusing. I find it quite confusing because a change in situation goes from telling the NDIA that the address has changed right through to a high risk, high complex situation. So to me, it's about, as a support coordinator, really thinking about your practice, putting those strategies in place, building those connections and collaborative working networks so that together you can work together as a group to manage a situation. And also what that does is it enables you to gather evidence from all that stakeholder group. So it's not just you saying, this is the situation, here's my evidence, I've got an action plan, I've got a risk assessment, this is the assessed risk, something needs to happen quite drastically. You've also got evidence from that that service provider group that is reinforcing an evidence in that need. And what the example that Nikala gave was a prime example. So let's have a look at the NDIS change of situation form. Okay, so when you do a change of situation form, there's two things that the NDIS ask you about: a plan variation. Is a plan variation required, or a plan reassessment? So a plan variation, so the laws changed a couple of years ago around reviews and what they meant and how they're supposed to handle. So a plan variation is when a participant needs additional funding for a support already identified on the NDIS plan, or they might need a different support. So a plan variation could be around, you'll be working with a participant and a crisis happens and your NDIS, your support coordination funding is running out, and you need, if you know that if you get additional support coordination hours, you're actually able to manage that situation with the stakeholder group. That's an example of funding that's already on a plan, but you might need additional support. Or it could be a situation where, say you're working with a participant and there might be some assistive technology needs that are quite high costs, and so you've gone through that whole process around assessments and things like that, and then you're wanting that funding to be added to their plan. So that's what the NDIS talk about in relation to a plan variation. A plan variation, though, is when, again, the majority of the funding and the support being able to be accessed through that funding continues to meet the participants' needs. And again, there's enough funding to last for the rest of the plan. Okay, so I hope that makes sense. Okay, whereas a plan reassessment is quite different. So a plan reassessment is a full reassessment of a participant's needs. So it used to be called a plan review or an unscheduled plan review. The language now is a plan reassessment. So the NDIA can set a plan reassessment date, which is generally 3 months within the end of a participant's plan ending. When you put a change of situation form in, you can request that that full reassessment gets brought forward. So you would do that if it was a significant change in situation, there's high risk, there's completely different supports that are required, and the funding and support no longer meet the participants' needs, and they basically need a full reassessment of their disability-related needs. So again, we come back to the evidence side of things. So when supporting a participant to submit a change of situation, it's obviously always important to provide the evidence as a support coordinator to substantiate the recommendations being required. So a support coordinator's role is to identify, assess, gather that evidence and make recommendations. So these are the supports that are required. And then the NDIS's responsibility is to assess what those supports would look like, how much they would cost, and then allocate the funding on the plan. Okay, so support coordinators do this. They evidence especially high risk or high complexity through a completed risk assessment and a risk management plan, which is obviously evidence of the nature of the risk, so the likelihood, what type of risk, and what are the contributing factors that contribute to that level of complexity and risk. The strategies that have been implemented, so that you've had, say, for example, a situation has happened, you've got together for a case review meeting with all the stakeholder groups and the participant and their network or their support systems, and you've talked about the situation, you've talked about the impact, and you've talked about, so what supports are required, what are the strategies that as a group we are going to put in place to try and support this participant to get through this crisis and to stabilise the situation. So that's when I'm talking about who's going to manage the risk and take responsibility for that. So what is the service provider going to do? So is the service provider going to look at the behaviour support plan and providing additional training for their support workers and working a lot closely with the behaviour specialists around that behaviour support plan? So it's about understanding that it's not a support coordinator's responsibility to manage all that risk. It's about the whole stakeholder network taking responsibility. So what are you going to do? What are you going to do? What supports are you going to put in place? What assessments are you going to do? And the other thing that a support coordinator should be doing when they're putting in a change of situation form. So a change of situation form is literally a template. It's a guide. So a change of situation form is really you are providing a high-level summary, dot points, and then referring to your evidence. So refer to the OT, occupational and functional capacity assessment, refer to the support coordination risk assessment, refer to the support coordination report. So I always best practice accompany any change of situation I do with a report, because you've got to remember that you need to be able to write something so that, because the person who is reading that needs to get the whole context. So my report always brings everything together. So we always talk about what was the change of situation, what happened, what was the impact for the person, what are the factors that contributed to the higher level of complexity of risks. So what is it? Is it around the person, a degeneration in the person's health? Is it around environmental factors like what's happening in the home? Is it around the person's personal factors? So things like the impact of their disability. Is it around the person might have a psychosocial disability and they become incredibly unwell? So what are the factors that are contributing to creating all these barriers for this person? And then really talking about what are the supports that are required to support this person, to have an appropriate level of support around that person. And it's very much what Nikala was talking about before, is around getting those proper assessments in place and working with that collaborative network of supports that surround that person, bringing them together to really talk about how everyone's going to contribute. And so we all know the change of situation process at the moment with the NDIS is not great. I've talked to support coordinators who have said to me it's taking up to 6 months to get a response, which is totally inappropriate. So it's about going, well, here's our stakeholder group, here's our network of supports around this person. How can we support each other to leverage or escalate this situation? So supporting the person to contact the NDIA and talking to the NDIA directly, bringing advocates into play so they can support the participant to have more advocacy support, working with the stakeholder group to contact those provider engagement teams. So it's around working together as a group. Okay. So when you put a change of situation form in, basically the NDIS will look at that form and then they will make assessment around whether it's a plan variation or whether it's a plan reassessment. So that's about, okay, so here we are. I think we're starting to get some questions coming through. Okay, that's awesome. Fantastic. Risk assessment and risk management plan. I thought this would come from the provider. Okay, so I've finished my spiel. I'm going to come to the questions. Okay, so I'm just scrolling back up to my screen so I can see them now. Okay, so Kathleen has asked, can you elaborate more on the support coordinator risk assessment and risk management plan? I thought this would come from the provider. Okay. So there's different focuses. So a support coordinator has a focus around the participant support needs, building that resilience, building that support network, and ensuring that a participant has access and inclusion to those supports and services. Yeah, that's our goal. Our capacity building role, how do we build capacity? Make sure the person has capacity. So when we do support risk assessments, we're doing it from that factor. So we're coming from the focus of this situation has happened, the support network or this provider, these supports are broken down, the supports are no longer available, or whatever the situation is, we're coming from that focus. So we're actually saying this is the situation, this is the impact on the person, and this is the impact that it's had on this person. And this creates risk around either risk to harm to the person, risk to others, or it could be risk of that if nothing changes, the support network is going to fail, and the person isn't going to be able to access those supports and services. And if that happens, then this is the impact for the person. So that's where we're coming from. That's our focus. Whereas a service provider would be focusing on the service that they deliver. So their service, say with the situation that Nikala is talking about, she would be looking at a supported independent living. So if the person's behaviours escalated or changed, they might become more aggressive or whatever that might be, then they need to step back and go, let's do a risk assessment about how this is impacting on the person, on the staff, but also the person as well. How does that create barriers to the person getting the support that they need? And what assessments do we need to determine what's actually happening and what level of support is actually required? So they're coming from a different focus. Hopefully that makes sense. If you want more information around risk assessments, then email us at info@SC Academy, and I'm happy to talk to you more about that. Okay, I'm going to keep going through. Question from Paul in chat. I'm a support worker and my client's support coordinator has requested a plan review instead of a budget review as they've run out of funds. We have been waiting for 2 months for review and not able to invoice since November. Okay, I would need to understand the context of that situation a bit more. As they have run out of funds, we've been waiting for 2 months for a review. Okay, there's our next webinar is talking about how to manage support coordination hours. So come to the next webinar because we will talk about this specific situation in more in depth. It's really about putting that best practice in place. How do you not get yourself into a situation where your funds run out? How do you do that pre-planning and put strategies in place before this happens? Okay. Sorry, Paul, that I'm not actually answering your questions, but that is coming up in another webinar. Question from Lydia. What reports are involved in the change of situation? All reports are different. As a support coordinator, if it's a very highly complex situation and there's risk involved, I would be doing a risk assessment and a risk management plan and a report, and I would be attaching that to the change of situation. If it's around needing a full reassessment of a person's support needs because there's been a significant change, then I would be getting an updated OT functional capacity assessment report. If it's in relation to, it might be in relation to some equipment needs, or it might be in relation to psychology, deterioration in the person's mental health. It might be a psychology report that's required. So evidence required depends on what is the change in situation? What is the impact for the person? Who are the stakeholders involved? Or what supports are required and why? Okay. Questions from Samson. Hi there, I'm not an NDIS support coordinator, but an educational professional and wellbeing role trying to understand all this. My question is, if a support coordinator has already put a change of circumstances review and NDI hasn't yet given an outcome, it has been escalated by the LAC, what actions does the support coordinator LAC have, especially if funds are run out? It's about escalating the situation. So again, my first approach would be, before you get to that situation, bringing that stakeholder group together and working as a group to contact the service provider engagement teams, contacting the LAC, building those collaborative relationships with the planners and the LACs and having those conversations, providing the evidence around the urgency. So not just from yourself, but from those other providers as well, and the impact of nothing changing. Also, I mean, and then there's other strategies around contacting that 1-800 number and asking to speak with the team leader. If you're feeling that the situation, that the NDIA ain't taking the situation seriously enough, or they don't understand the urgency or the risk to the participant, asking them to escalate the situation, documenting it in their notes, or asking to speak with the team leader. I found that those have been very effective. Other people have got local members involved, things like that. But to me, it really does depend on different situations. I also find linking in an advocate to support that person to have a stronger voice is always a good strategy as well. Okay. Can you please confirm the time frame of response from the NDIS? Okay. How long's a piece of string? You would need to contact the NDIS under the participant. Sorry, what's it called? The participant. Can't remember the next word. It's basically a guideline around when the NDI needs to respond. My understanding, a change of situation was 21 days. So the challenge at the moment is there's a massive backlog. We don't know why. No one's telling us. We don't understand what's changed with the NDIA. We are just experiencing the fallout of that change. So again, it's about planning ahead. You know, like if you've got to change a situation and it's urgent, you should be putting reminders into your calendars to say, right, what is the time frame that we need the NDIA to respond by? So what is the strategy that we're going to use as a team to make sure that they respond within that time? You can't just put a change of situation in form and then just leave it and then just wait and wait and wait and wait. You need to, your response needs to be reflective of the urgency or the priority that you need the NDIA to respond. Hopefully that is helpful. Okay, we have a current challenge where support coordinators are running out of funding as participant is only engaging with support coordinator. It's not engaging with any other providers, so no reports or evidence. Participant always just responds with ask mum, so hard to understand what he wants or what his real goals are. Justice involved, DA and A issues. Is it worth submitting costs for just SC hours? Bronwyn, just based on what you're saying, I would say this needs to be escalated to specialist support coordination. Clearly, what is happening or supports around this person are not effective. They're not supporting the person to achieve their goals. They're not creating capacity. They're not creating resilience. There seems to be a lot of risk and high complexity. I would say this is a specialist support coordination, needs to be escalated to specialist support coordination. So I don't think additional support coordination hours is going to give you enough time, or because specialist support coordination needs to be at a much higher intensity. It needs specialist support coordination is coming in with more of a stakeholder focus. How do we get the stakeholders to come together? How do we get them to work together? How do we get them on the same page, the same agenda? Okay, if you want more information about this, email us. Okay, I'm just mindful of time. Okay, we will have time. Okay, no, I'm going to go right up to the top because there's more posts. Questions from Veronica. Okay. Advise when submitting a change of situation where the client is in need of SIL accommodation. Sorry, Veronica. I need a bit more information. So my assumption of what you're saying is, would you submit a change of situation if you're working with a participant and they need SIL accommodation? Yes, absolutely, because you need different supports and their needs have changed. Absolutely. Can you please send the link regarding the next webinar, Connie? Okay, questions from Nerida. Functional capacity assessments. What time frame of report will NDI accept a COS and COS report less than 12 months on? I'm assuming you're referring to how long the OT functional capacity assessment, how old? We talked a bit about this last week. So functional capacity assessments are around the impact of a person's disability. What is the functional impact for a person? So if you've got a functional capacity assessment and nothing has changed around the functional impact for that person, then you don't need to get constant functional impact assessments all the time. It's about understanding the situation. So if you're going for a change of situation because there's been a significant change, there's huge complexity, there's high risk, the person's support needs have changed, their goals have changed, they need completely different funding, then I would be getting a functional capacity assessment. Absolutely, because something's changed. The impact of their function, the impact of their disability, something has changed. So, but if you're going to the NDIA and it's a change of situation because you need additional support coordination hours, then you wouldn't need a functional capacity assessment. So I would need to understand the situation a bit more, but I suppose hopefully that clarifies something for you. Okay. Here we go. This is an issue I see all the time. So Joe, how do you suggest the SCs respond to the NDIA not taking into account any of the advice and recommendations made by the therapists? This is a massive issue. Absolutely. Totally agree, Joe, and it's completely and utterly frustrating. And it's something that I've come up against, and it's like hitting a brick wall. You go to do all this work, you work with all the providers, you gather all this information, you get all the assessments, you send them in, and then you have a meeting, and then the person that you're having the meeting with hasn't read the reports or doesn't understand the reports. So I think it's really about, for me, when this situation has happened, I have literally been in that situation, and I've said to the person within the meeting as I'm supporting the participant, can you please tell me if you've read these reports and what's your understanding of those reports? So I basically get them to come back and go, please clarify what you've read. Tell me what your understanding is, because what I'm hearing from you is not matching to what we're seeing in the reports. Can you please explain that? And so I've kind of held the person accountable, but also tried to, have those conversations within the meeting. And I found that that's helped a bit more because it's kind of opened up their eyes a bit more and going, well, can you explain to me what you mean? And I've said to them, well, I'll give you an example. The functional capacity assessment says this. This is the impact, this is the supports are recommended, and this is why. So by putting these supports in place, this is how it's going to stabilise those supports, build some resilience for the participant, and increase their capacity to be able to achieve their goals. So that's why we've recommended those supports. So can you tell me a bit more about what your understanding is? And that's how I've approached the conversation. I found that that's been quite helpful. Sometimes what we've had to do is actually to completely stop the conversation and go back and set another meeting. But otherwise, sometimes I've seen support coordinators put complaints in after they've come out of a meeting and supported the participant to put a complaint in around the actual meeting. So hopefully that helps. Again, Joe, I would need to have some more context. Okay, so Lavina, how old report has to be for the NDIS? Sorry, I'm not quite sure what report you're referring to. We've been advised by sorry, I've got to go. And the NDI inbox is congested. Yep, I've been advised that as well. Okay. So yep. Sorry, got to stop. If you have any more questions, feel free to send them to me at info@SE Academy, or if you have questions for Nikala, you can send them at hello@endeavour.com.au. Providing context is really helpful. Happy to ring you and have a conversation. But in relation to the queue, I've heard exactly the same thing. There's a huge backlog. They're not even getting to the emails. So again, making sure you're collaborating, you're using the whole network to provider engagement, LACs, planners, advocates, whoever that needs to be able to support you to get your message across. Okay, I'm actually going to go to Gemma.
Thanks, Mary, and thanks, Nikala. That was very informative. So lucky door prize winner, congratulations, James Lanham. You are the winner of the coaching session with Support Coordination Academy. We'll send you an email after this session so that you can claim that prize. So congratulations. And then just moving on to the last slide. So I've seen this question come through in the chat a bit today. The next session is being held in March, on the 20th of March, and the topic is support coordination hours, how to manage the limited hours available. And also, I've seen this question come through. This webinar recording will be sent out after today's session to everyone that has registered and also attended. We'll also send out the PowerPoint slides, so you'll have access to them. So you'll be able to watch them whenever you like, or pass them on to a co-worker that wasn't available today. The other thing that will be coming out in the email following this session is a survey link to provide feedback on this session, which will help us moving forward to improve these sessions for you. What I'll do is I'm just going to drop that survey link actually into this chat, and you can access it immediately if you want to provide feedback, straight away while it's fresh in your memory. So thank you so much for today and attending, and we hope to see you at the next session.
Okay. Thanks everyone, and I appreciate it, and sorry that we have to go. But again, if you have questions or you would like to catch up for a chat, happy to do that if you email me. The other thing is too, there was a question in here around timeframes around the NDIS is supposed to be responding. If you get onto the NDIS website, there's a participant charter. There you go, remember the word. There's a participant charter, so have a look in there that talks about timeframes around when the NDIS are supposed to respond. So hopefully that helps. And I'm actually looking at the chat and I can see a lot of frustration and a lot of great work that's happening, and I really do feel for you. But anyway, happy to chat if you want to. Take care, everyone. Thank you for everything. Nikala, do you just want to say a few words before we go?
Just a goodbye and thank you for joining us. It's great to see so many people joining these sessions, and I look forward to the next one.
Hello everybody, welcome to our Learning and Lifestyle Hub. This is where we make learning fun.
Hi, I'm Grace. I live independently with support when I need it. I live my life my way.
Hi, my name's Jeremy. My daughter's 3 years old. My daughter's proud that I come to work.
Hi, I'm Maddie and I work for the Endeavour Foundation. I come to work with a big smile on my face every day.
Love to work here because that's my new family.